Hi, all. Welcome. Thank you for joining us this evening. We'll get started in just a moment. In the meantime, feel free to take a look and introduce yourself in the chat and share something that is as we approach Rosh Hashanah, the Jewish New Year. What's something that's giving you a little sweetness right now? Hi, everyone. Welcome, everyone who's joining us. We'll get started in just a moment. But in the meantime, please feel free to introduce yourself in the chat and share something as we approach Rosh Hashanah that's giving you sweetness, providing some sweetness right now in your life. Love everything that I'm reading. Wonderful. And we're gonna stay prompt and get started right now. And we are recording this session. Feel free to continue to introduce yourself in the chat. So I want to welcome everybody this evening. Thank you so much for joining us for this important conversation on parenting unvaccinated children in a post-vaccinated world, back to school edition. My name is Rachelnelson, and I'm the Director of Educational Initiatives and the Associate Director for Community Relations at the Jewish Federation of Greater Portland. This program is being brought to you by the Jewish Federation of Greater Portland and Jewish Family and Child Services. As I mentioned, we are recording this session. Thank you for joining us this evening. It's such a complex conversation and topic, especially with what feels like constant changes from the CDC and the state. And for those of us enrolled in preschools, the early learning division, as well as just the Oregon Department of Education and schools at large. While I work at the Jewish Federation of Greater Portland, I'm also the parent to a 2.5-year-old and a nearly 4-year-old. And when vaccinations started rolling out, I was feeling completely lost. So I turned to my pediatrician and brought a list of scenarios and people who we may or may not be able to see. It helped me so much that we brought this session to PJ Library families in May. Thank you, Dr. Meyer, who is my family pediatrician. And it was a real success. We had so many families who just got so much out of it. Now the world feels like it's changing again, and we have even more questions. We all hoped we would be entering into a more positive situation, and many of us would feel more, and now many of us feel more confused and more isolated than we did a year ago, 6 months ago, or even 6 weeks ago. I want to thank you, Dr. Meyer, for agreeing to come back to help us work through these scenarios and questions. While there is a medical component to all this, there is the mental health arena that needs to be addressed as well as we look at the constant changes happening in our community and the world. So I want to thank Dinah Gilbert for speaking to that tonight. And finally, we are a Jewish community, and many of us use Judaism to guide us in the actions and conversations. So thank you to Rabbi Eve Posen for bringing those points in. I'm going to formally introduce our presenters. Erica Kempler-Meyer is a pediatrician and mother of 3. She is a member of Neve Shalom, serves on the board of Jewish Family and Child Service, and is active in the Federation's Women's Giving Circle. Dr. Meyer is a graduate of Harvard Medical School and completed a residency at Dornbecker's Children's Hospital. Before medical school, she studied anthropology and taught first grade. She has been in private practice with Metropolitan Pediatrics in Portland since 2003. Her professional passions are in child development and building resilience in children and their families. Dinah Gilbert, licensed clinical social worker, is a clinical social worker with Jewish Family and Child Service. She presents workshops in the Jewish community that support the mental health needs of children, adolescents, and families. As a child and family therapist, Dinah has over 25 years of experience. She relocated from Boston, where she worked as a supervisor and clinician at Massachusetts General Hospital in the outpatient behavioral and counseling department. As the Associate Rabbi of Congregation Neve Shalom in Portland, Oregon, Rabbi Eve Posen delights in learning from and teaching all ages and stages of her community. Rabbi Posen has taken up distance walking over the last year and recently hit a new record of 30 miles in one day. And is a mother to Shiri and Matan, partner to Duncan, and human pillow to Stanley the dog. Rabbi Posen will share some words of Torah with us before Dinah speaks for a few minutes, and we will then hear from Dr. Erica Meyer, and we'll leave the bulk of our time for questions tonight. We encourage you, if you're comfortable, to leave your cameras on this evening so we can create a community here. If you are comfortable, please feel free to use the raise your hand feature to ask questions using the Zoom function. It's in the reactions section of Zoom. You can also ask questions in chat, either in the communal area or privately to myself. And if you would like to ask a question anonymously, I am putting a link in a moment to a Google form where you can submit the questions and I will ask them. Additionally, I do have questions that were submitted prior. Please also remember that we represent a broad cross-section of our community. So when you speak, try to speak as much as possible in generalities and not naming specific programs. So I'm now going to pass it to Rabbi Eve Posen.
Thank you, Rachel. I had this whole thing timed out, and then the sprinklers were on in the neighborhood at the bench I was going to sit on. And my children, they're still screaming at home. So luckily, my neighborhood, you can't even see where I am because I have a prop behind me. But I am grateful. Dr. Meyer is awesome, my pediatrician. And I haven't bothered her with these questions because I usually wait till she shows up on the high holidays and then hand her a sick child and say, what do I do? Clergy privilege. But we're in this space. I just got off a congregational meeting about the high holidays. And my background, if you can see it behind me, that is the screen of my Magic 8-Ball. Because today I got to the point where probably as a parent, I mean, I feel like this is a parent all the time. The kids ask the same question 15 times and the answer doesn't change. So the Magic 8-Ball is like a fun tool. But then today people are asking me real questions about the world. And I was like, cool, I'm going to just ask my Magic 8-Ball. And it gave me, the first time I shook it, it said, cannot predict now. And I was like, oh, Magic 8-Ball, you've let me down. I need an answer. And you spoke the truth. And I saw that little triangle on the Magic 8-Ball, and I thought about this week's Torah portion, which is Parshat Ki Tavo, which is one of the last Torah portions as the Israelites are getting ready to go in the land of Israel. And it is one that is super filled with uncertainty. And the Torah says, it's God saying, if you listen to me and you follow this, blessings, and if you don't, curses. And at the outset, I read it and I'm like, cool, they had this like really awesome outline of what to do. That must have been amazing. Lord knows I want like do X and not Y and you'll be fine right now. But then I dug into what those blessings and curses were, and they're really reliant on community and on what it is that we do together. And that notion of cannot predict that my Magic 8-Ball gave me is really also resonant in the Torah, not in the down way, not in the negative way that I perhaps read it when I first got it today in my frustration, but in this moment of we know the way forward in blessing and we know the way forward in curse, quote unquote. I don't really love the Torah language in that space, but what it all relies on is how we hold each other as a community and the work that we do together. And the truth for me is when I read this is that we can predict how we will be, not scientifically, not medically, that is not my field. But the fact that we know that we're holding each other and that we're asking questions of one another and that we can find a trusting space both to ask and then to act is how we can fully predict how we will come through this. And it will be a space of blessing because it will be a space where we've modeled for our children and held ourselves in a space of dignity and respect and understanding. So as we walk this moment in this particular Zoom, I know we've done it respectfully in all the other Zooms that we've had. I feel like the Magic 8 cannot predict now is really about the more global sense of everything around us. But what we can predict is the fact that we are a loving community, that we're all here because we're looking for guidance and reassurance and holding one another, and looking at every screen is a spot of knowing that we're not alone. And as the Israelites, Ki Tavo, when they came, because you will come, is the translation. They came and they came together, and we're going to walk this together as well. And so my blessing is that we can continue to walk this together. And while we may have to live in that for me, horrible place that is the unknown. It's less scary because we also are doing it together. And may we all feel that we are together.
Yashar Kochach, thank you so much, Rabbi Posen. I am going to pass it over to Dinah now.
Thank you. Thanks, Rachel. And thank you, Rabbi Posen, and a warm welcome to all of you. So here we are again. And here we are again coming together as a community at a time of uncertainty, a time of fear, and a time of change during this pandemic. And with such a timely and relevant topic, parenting unvaccinated kids in a post-vaccine world, I am very grateful to have Dr. Meyer back again to guide us in following the science. And so tonight, very briefly, because I know so many of you have so many important questions, and I want the focus to be on what Dr. Meyer presents, I want to talk from a mental health perspective and offer some very simple yet effective techniques and methods to what Dr. Gary Chapman calls fueling your child's emotional tank. And what that does is it counteracts the harmful effects of stress. And so you may be familiar with some of these practices. And my hope is that you will find one or two of these practices useful and bring it into your daily lives. So the first practice is to be present with undivided attention when you spend time with your child. And it means closing your laptop, stopping your emails, your texting, and multitasking, especially when your child returns home, having been away from you during the course of a day, because in that moment in time, your child needs to reconnect and receive your love. And as you are reconnecting, you may want to ask age-appropriate questions like, what was the best part of your day? Or what was the hardest part of your day? And what are you looking forward to? And another simple practice to fuel your child's emotional tank is the practice of gratitude. It's my favorite practice, and gratitude focuses on the positive parts of the day. What went right? And showing gratitude is an expression of goodness and warmth, and it just enriches your day. This can become a family practice, either at dinner time or at bedtime. And for a younger child, you might want to ask, what made you smile today? What made you happy? And for an older child, you might want to ask, what do you appreciate about your day? What are you grateful for? Who are the people in your life that you are grateful for? And parents can share as well what you appreciate and what you show gratitude for. And next on the list of daily practices, which I think is probably the most important, is self-care for parents. This is essential. This is not being selfish. It's not about how can I take time for myself, right? When I need to focus or ought to be focusing with my children, because everyone in the family benefits when parents practice self-care. Your children look to you in times of stress, and they see how you are managing. And if you're calm, they're going to feel reassured. But if you are stressed out, they're going to feel unsafe. So the message is, and I'm sure that you've heard this time and again, put on your oxygen mask first before you offer your help to others. And check in with your emotions. See if you can respond instead of react, especially at difficult times. And so what does that look like? A really simple technique is to use your breath. Your breath is always with you. You don't have to make an appointment. You don't have to leave in order to have a visit. Your breath, if you can remember to breathe in and out a couple of times and extend your out breath to feel even calmer. An additional mindful practice to add to your breath is the acronym STOP. S is for stop. Stop whatever you're doing. T is take 3 breaths. O is observe. Observe what's going on in your body. What emotions are coming up for you? And P is to proceed. with clarity and calmness. And these techniques can be used and taught to your children as well. I was also going to suggest as part of self-care, and then I thought, well, maybe that's enough. And parents are going to say, no, that's enough. I just have time to breathe. I just have time to do this. But what I also want to add, and I think it's incredibly important right now, it's the practice of self-compassion. It's being kind to yourself. This is not a time for you to be a perfect parent. It's also not a time for you to be judgmental and critical of yourself. And what I suggest to parents is that they treat themselves with loving kindness, the same way that you would treat a close friend who comes to you struggling with a problem or an issue. And I want to end with mentioning an exciting outcome of all of our community get-togethers that have actually been going on with Jewish Federation for the past 14 months. We are planning to offer a drop-in support group. This is going to be a group for parents and caretakers on Zoom. It will meet twice a month. September 9th is the first meeting, and it will be an opportunity for parents and caretakers to share their thoughts and feelings in an open forum where you'll be learning and listening to each other. And I will be facilitating. So I'm going to ask you to stay tuned for further details. Thank you.
Dinah, thank you so much. And I will be sharing a little bit more about the workshop or the facilitated sessions that are going to start in September at the end of this call. And then we will be sharing it again in the newsletter. I'm now going to pass it to Dr. Erica Meyer.
Thank you. And thanks for your words, Rabbi and Dinah. Those were really helpful. I hope everybody took a deep breath when Dinah mentioned that, because that's always a good thing to do. I know I did. So I'm going to start. I mean, there's a lot of questions, and I like answering your questions directly. I really like seeing your faces when I answer questions. I do a much better job when I do that, but I totally will do all of the ones that are in the chat as well if somebody reads them out to me. I wanted to start, I don't know, this week, I don't know if you listened to the daily podcast, and this week, Emily Anthus, who's a medical reporter, gave a talk similar to this, answering questions about COVID for school-age kids. And I thought one of the things that she started with, I thought I would use, because I think I've been using this a lot with my families when I get questions. And it is, before we answer all these difficult questions and the specific ones, as well as the general ones, we all need to understand where we're coming from when we ask. And one of the things she said was, what are your priorities? And I think, to me, that's all of you, your priorities are probably your children. We have lots of priorities, but you wouldn't be here, I don't think, if your children weren't your first priority. So I think that might be too simplistic of a way. It's given that our children are our priorities, but understanding what are your personal factors that you need to consider when you make decisions. Do you have elderly people in your home that you're protecting? Do you have, a disease yourself that puts you at specific risk? What other things are you considering when you make decisions for yourself about answering these questions and the types of questions I'm getting? So I think everybody just needs to know that, and then not to judge people, because we don't know what other people, don't judge people and think. I know once somebody told me that they were judged by their family for putting their child in daycare, and which is just so sad, that, people assume that, oh, you're not putting your children first. You're being selfish, which is just so wrong. And as most of you know, whose kids probably are in school, you might have felt some of that. And I think understanding where people are coming from, but also not judging people who are afraid to put their children in daycare, that everybody's coming at these from different levels of risk and different comfort levels with stress and tolerance for different things. So just kind of a little starting point, think about for yourself, what's important to you, who are you trying to protect, what are you comfortable with, how could you handle different things happening, how do you do with flexibility, do you have a backup plan, things like that. And now, coming back to this, the other thing I just wanted to generally address are just some of the big differences. And, this has been so frustrating. I think you can all remember a time 15, 16 months ago, don't wear a mask, it's not airborne, it's on the surfaces. No, do wear a mask, it is airborne. I mean, this has been a very difficult process. And as a provider, it's very difficult and frustrating not to be able to give evidence-based answers as much as I can do for most other things. And so be patient with the answers, knowing that they're going to sometimes change. Anthony Fauci is speaking on this topic September 9th. So, anything I say, if he says differently, go with him. I will do my best. And the differences now, I think, are pretty significant, but also a lot of the same principles. And we're in such a better place as far as knowing much more, as far as, yes, we have vaccines and they're not 100% for Delta. We know that, but they certainly are in the high 90s to keep us out of the hospital and keep us from getting very sick with this new variant. So we're vaccinated now. Teachers, parents are vaccinated. We know how the disease is spread generally. We know the layering safety precautions that are working in schools, that there haven't been major outbreaks in schools and daycares. There's so much more that we know now that can make us feel safer and kind of bring us down a notch. And even if Delta changes that at some level, I think we still have some of that data that's looking like we can keep ourselves safe. And probably your children in preschools and schools and daycares, it looks like they're safer than they are out in the community. So I think that's just a good celebration for preschools, that they're doing a really good job, especially your schools, of keeping your kids safe. So, with that, I will specifically answer questions or generically answer questions, however you guys want me to.
Great. So I am happy to moderate. I am putting again in the chat the anonymous form to ask questions. You can ask questions one of three or one of multiple ways. You can ask them by using the raise your hand function, and you can get on and ask your questions. You can ask them in the chat either directly to me or just in the chat itself, or you can submit through the anonymous form. I'll start with some of the questions that have been sent in already. So I'm going to start with a couple on air travel. I have two on air travel specifically, advice on possibly flying cross country with an 8-month-old, and just in general, thoughts on air travel, specifically to places that require testing before departure and after arrival.
Okay. Again, we're not going to judge people for the decisions they make about travel, because we are in our place of kindness and compassion. People will need to travel, and we're in a pandemic. It is a scary time to travel, but generally, being the fact that you're on an airplane with your baby is generally actually safe. HEPA filtered, your baby can't wear a mask, but we can kind of, extrapolate this to whether you're safe versus your baby. What is unsafe is maybe what you're going to do when you get off the plane. So the fact that you're actually on the plane, I think, is actually relatively safe. There have not been big outbreaks, shockingly, on planes. Even the Delta variant, I think we would start to see it. I mean, I think we're still sorting out this new data. It's so much more contagious than the other variants, that's for sure. We know it carries a lot more virus, but we're wearing masks and people are vaccinated, not everybody. And airplanes have excellent HEPA filters that do filter the air. So you're really just exposed to the people right around you, and, sit in the window seat. That will protect you and your baby much better. The window seat, just has less exposure to the other people on the plane. So if you need the leg room, sorry, go to the window and scoot over. If you can put somebody between you and a barrier, that's even better. And then the question about places requiring, that's kind of an interesting question. I mean, I think, like, if you're talking about Hawaii, like that, and that's one place that has come up a lot. They're actually asking people not to go to Hawaii now. So maybe just rethink that if you were thinking about going to Hawaii. The governor has actually specifically said, please don't come to Hawaii, even though you legally can. So I might rethink those plans. But as far as the testing goes and whether you should be tested before or after, if it's required that you're tested, yeah, you get a test. I think that's actually pretty safe because it's really what you did when you traveled. So if you test before you come home, that protects the people back in your home. But then, and I don't think it's as likely that you're going to pick something on the plane. Generally, for people who are traveling to high-risk areas and doing high-risk activities, nobody appreciates that. So I would just, if you really have to go to Florida or a place where they're having significant problems, wear a mask. Don't go indoors, in indoor restaurants. I mean, try to, be as safe as you would be here.
Great, thank you. I'm going to turn to, we have several questions about masks. So what kind of masks do you recommend for school?
So first of all, the most important thing about the mask for children is that they wear it. So that's a priority. I mean, there's some different masks I've seen kids wear. I mean, the safest mask is one that is like glued to their face and has a really excellent filtration. But a couple factors make masks safer, but I don't know if this always applies to children, because if the mask is really, really safe, but it's uncomfortable, you guys know your kids, they're not going to wear it. They're going to be moving it, playing with it, touching it. So comfort is really important for kids. They do make those KN95 masks for kids, but they're disposable and expensive. I think they're relatively comfortable. So if you have the means, that might be not an unreasonable thing to get. Cloth masks that are worn do a good job. I mean, they're not perfect. For kids and for adults, masks should be away from your face. You don't want it, sometimes I see people coming in with their thin cloth mask and I can like see their lips, through their mask. I mean, that's not effective. The mask needs a little space to filter the air. And so you need to have a little space in front of your nose and mouth. So that some people are trying to get those masks so tight on their kids that they're kind of decreasing the effectiveness of the mask by making it that tight. So I'm not going to really brand recommend, but I'll throw some out there. People have said, like, there's a happy mask that I think is really comfortable for kids. I haven't seen it, but I've just heard people talk about it in some of my other Facebook groups with other physicians.
I know my kids really love the Joa Love masks.
There you go. Yeah. So when kids like a mask and they're comfortable and it meets kind of the minimum criteria, I think that's reasonable. I mean, the fact that you just want them to wear it and not make it something that's going to have them touching their nose and mouth more.
And along that line, what is your take on kids wearing masks outside right now?
I think, well, there's going to be some areas where that's just going to be required, but I think if they can't keep the distance, it's safer. I mean, it just is. So if they're going to be on a playground with a lot of kids and you can't be sure they're going to not spend more than 15 minutes less than 6 feet apart from anybody, then that's a definite indicator to wear a mask. When you have, large crowds, definitely wear a mask. Kids just running around outside with their own pod or their own family running around on the grass, I don't think it's necessary. Where you can, passing someone on a trail is not probably even necessary. If it's just like a quick, I'm passing you on the trail, hold my breath, walk by. But if it's a crowded trail and it's person after person after person, it might make sense just to wear a mask.
So you mentioned playgrounds for a moment ago. Is outdoor play, at one point, many of us were avoiding playgrounds, and I know many of us have started avoiding playgrounds again. Is outdoor play with other unvaccinated kids okay? Going to a playground, is that okay?
This is a time, I mean, the virus is surging right now. I would not spend time with people outside your kind of comfort pod that you've established for yourselves. I wouldn't go and spend a whole lot of time with lots of different kids that you don't know. You don't know if the parents are vaccinated. I think that would be considered not the safest thing to do because you just don't know. And playground, and kids are kids. They want to connect and play and, blow bubbles in people's faces. I mean, they do random stuff. I mean, I just had I was with my niece and this little boy came right up to her and just gave her a chocolate chip cookie, practically in her mouth. And she just took a big bite out of it. She kind of knew him. He was a neighbor, but if, kids do that stuff, that. So
let's switch a little bit to kind of childcare and daycare situations, preschool situations. Do you think it's safe to put an infant in childcare right now?
I think again I do think generally yes. And like I said initially, and I initially was trying to say is that I think kids have been very safe in these environments. I mean, I think we have seen that time and again. And a lot of it depends on your risk level. If you have a elderly parent, immunocompromised person in your household, you might not want to take on that extra risk. I mean, there is extra risk. Kids are gonna, excuse me one second. That was my dog, not my husband, in case you're wondering. Rachel.
No, sorry. Sorry, Rich.
Yeah, so daycares, what we do know is that the layers of protection that our daycares are providing our kids, and a lot of it depends on the daycare. Not all daycares are doing a great job, but most of them are. And if the teachers are all vaccinated, and if they're wearing masks, and if they're using, some spacing precautions like not overcrowding, spending some time outside, opening windows, or having HEPA filters or MERV 13 extra qualities of filters like the schools are doing. I mean, there's a lot of things, a lot of layers. It's kind of like that we were calling it that Swiss cheese. If you put 5 slices of Swiss cheese, there's no hole. And so just, cover all these layers of protection are actually quite good. And again, I still stand by that for most daycares and preschools that are doing all these things, your kids are probably safer there than they are out in the community, generally, because, from the things that people would get exposed to just going around their lives, because there's people actually thinking about it. And then if you know for a fact that your daycare, the other parents aren't vaccinated, the teachers aren't 100% or close to that vaccinated, then, I think, again, find a backup plan if you have that concern.
Do you recommend that for kids in school eating outdoors?
I think it's a good idea. I'm not going to be able to make this plan for everybody, but I think eating outdoors, you can't do this with younger children, but I think St. Pius is a school that I had heard that had the kids wear face shields while they ate so that they weren't like spitting while they talk on each other. You can space kids out pretty well while they eat too, but eating would be a time, and kids are going to be around each other. So I think doing whatever makes sense for that school, but outside is absolutely safer, spaced out is safer. I hadn't really thought about the face shield, like putting the food up underneath it. I think they'd become a mess knowing kids, but that's maybe not unreasonable little things that you can do for places kids need to eat.
And along the lines of daycare, so this is a family whose child is going to an in-home daycare with one other child. So it sounds like it's a family who's going to childcare for the first time. They're going to be experiencing germs and colds and coughs they've never experienced. What are just some of the best practices for keeping healthy, regardless? In
general, no, these are good questions. I mean, generally the best, as far as in keeping them safe at that daycare, it'll be the same process, vaccinated caregivers, hopefully, and cautions, but keeping kids well rested, doing all of the things that Dinah mentioned, including your own self-care. Your kids are healthier when you're healthier, and that includes your social emotional health, not just your physical health. Offering your kids healthy food, not forcing them to eat it, but putting out a lot of healthy food in front of your children, and getting outside. I mean, fresh air and exercise helps our immune system. We know that. There's clear evidence now that our social emotional well-being and that being outside, these are all just basic things that we should all be doing, and they help our immune system function. There really is, and there's no pill or immune boosting extra thing that I would recommend other than all those healthy things.
So pivoting to just kind of external things once school starts, should my kids stop spending time with their vaccinated grandparents once they're back in school?
Again, have a conversation with your parents. I mean, I think that's a really great question, but this is going to be unique for families. If you, what we know, kids can spread the virus. Most outbreaks that happen in schools from the data we do have, has happened staff to staff is the most common. Then comes staff to student, and then lastly, student to student. And that's kind of how we see spread go. And so the kids are less likely to get it than the other staff members actually are in school settings. That being said, once kids do get exposed to the virus and carry the virus and are infected, they're pretty good at spreading it to other people in their own home. So if you have somebody, that's why I'm saying, like, if you have a high risk, immune compromised, high risk person in your home, you might want to rethink, maybe hold off on daycare for a month or something, wait to see what's going on with the Delta virus in this next month. I mean, that's a tough time. Because if they do get it, which they're less likely to get it, but if they do get it, they're pretty good. They're effective spreaders, it turns out.
So along those same lines, if you're in school, should we avoid other things like attending religious school, or with the holidays coming up, going to Rosh Hashanah services?
I'm going to wait on that. I'm not the rabbi. Outdoor services, I think, can be really safe and effective. I love the idea of these, drive-through meetups that Eve has been doing for Shabbat or other things. Being indoors in a crowded place right now when the hospitals are full, I'm just going to be honest, I don't think it's a great idea. But yes, we're vaccinated. I mean, this is different for everybody, right? There are some people where when I said social emotional health is important, I really mean it. There are people for whom not attending in-person services with their congregation is going to be way worse for their health than passing by somebody with the coronavirus. I mean, it's just different for everybody. It's a really tough question. So if you're at that place, everybody has their different levels. Being together with your community is really important. It's good for us. It helps us be healthier. And it's really easy for me to say, I'm not going to go to in-person services probably because I'm lucky enough to, I have 80-something-year-old in-laws, and I'm lucky enough to have a family that I can congregate, and we almost have a minion. In fact, I think we do this year because my nieces and nephews are all coming in to their parents' house, so we can be outside, spread out. I know everyone's vaccinated 6 feet apart, but not everybody has a family that they can do that with. So I think that it's a tough question.
You did say that you're not a rabbi. I'm gonna chime in for just a second here as the rabbi who has to make these decisions for young kids, that I'm struggling, and there's a lot of people here who the decisions that I make and our community makes affect. So I just want outdoors, and you mentioned the drive-in, which is sort of the model that most places are using. Are you saying that outdoors and that different, that distance space feels like a safer space for those kids with those models?
Yeah, I think being outside is much safer. Absolutely. I mean, I just think you have to that's what I was saying, that outside you can do so much. I mean, I think, I fear for rabbis' outdoor service that everyone, I don't know, I mean, when it becomes 600 people, I don't know, then it might change, but yeah. But places where you can, and I think it's really, ideally we can define safe spaces for people, but I don't know how all the other synagogues are doing it. I don't think our synagogue has figured out exactly how we're going to do it. There's ideas. I think things could change a lot in the next 2 weeks.
Yeah, I think a lot of synagogues are in the process of pivoting right now, and it's a daily change for all our local area congregations. And we will be including resources in the newsletter next week on ways to celebrate safely at home and in community.
Yeah.
So along the lines of gathering, would attending a wedding where everyone is vaccinated, is this safe for an unvaccinated baby?
Now, no. Not right now. I mean, so this is different time right now. We're in a bleak moment. I just have to say, our hospitals are full. So I'm going to just preface it. A few weeks ago, I might have said, yes, you can keep your baby safe outside. So if you're at a wedding, it depends on the number of people, but there's really not a safe way to congregate in a large group right now, indoors. There's probably not the safest way to be outside if it's a wedding, if you're going to bring unvaccinated children into that scenario, just, you have to keep the 6 feet distance as much as you can, 3 feet maybe at a minimum, but you want to keep that distance. You don't want anybody's plumes of air, even with a mask. You want to just try to really make sure your kids are not getting exposed, because this virus is twice as contagious as the previous versions of viruses we've seen. There's hundreds, if not 1,000 times more virus in the nose of someone who's maybe completely asymptomatic. And so we just have to be careful. If everybody's wearing a mask, that is huge. But a lot of times these weddings have been 100 people all vaccinated, so we don't wear masks because it's a wedding. And I have a dear friend whose daughter is supposed to get married in a couple weeks, and they're really struggling with this. But it's probably, and the governor, I think, has already given us the mask mandate anyway for outside. So I don't know. My gut is we're going to have to pivot on these things, at least for the next month.
So along the lines, given the increased spread of the infectious Delta variant, what is the minimum exposure time we should be considering or be concerned about? In the past, the CDC recommended 15 minutes, but now they're saying because it's more infectious, what do you think is the appropriate exposure time we should be monitoring?
You mean if you're exposed to someone who is positive? Are you
I think that more along the lines of, you were told to be in a space for 15 minutes or less.
Yeah, I think we're still in that area but it's cumulative, right? So if you're in that space, it's cumulative over 24 hours. So if you're in that space 4 times for 5 minutes in 24 hours, that's 20 minutes, that's over 15 minutes. So I haven't seen that change yet, so I'm not aware if it's changed. I think that's generally what we're using, but I wouldn't be surprised if it changes. But I think you're pretty safe, like making quick. That's why, we're not chatting with people at New Seasons when we go grocery store shopping. We're just, wear your mask, get in, get out, reduce the exposure.
Do you think babies are more in danger than they were before? Are you seeing more hospitalizations of babies?
Yes, we're seeing more babies in the hospital, but it seems to so far be kind of proportional to we're seeing way more cases than we have. So I wouldn't be surprised if it comes out that the Delta variant is worse on kids than the other ones, just like it's worse on adults, but it doesn't seem to be yet. We just don't see that evidence yet. It's definitely not a virus that picks on children, like respiratory syncytial virus or RSV, which many of you might have heard of. That's a virus that picks on children. It goes right to their lungs and makes it hard for them to breathe if they're under 2. Older kids do pretty well with it. They cough and they have a runny nose and a sore throat, but they get over it pretty quickly. So I think I think we would have known by now if this virus was going to be something that it doesn't pick on kids. It seems to pick on people of color. Sadly, it's tragically, we're seeing that as part of kind of systemic racism. So just the numbers of kids of color, Pacific Islander, Native American, Black, Latino children, they are vastly outnumbering white children and Asian children in the hospital.
Thank you for sharing that. Do you think it's imperative that we ask our medical professionals, including dentists, if they're vaccinated? Should we know that they're vaccinated before taking our kids them?
Absolutely.
And fall sports. What fall sports feel safe for our kids? What about swimming for our kids right now? Swimming lessons?
Again, if your kids are under 12, so they're not vaccinated, you just have to use those same precautions we talked about. Swimming, you can't wear a mask. I would probably, if crowded indoor pool would not do right now. The outdoor pools, if you can, I would just wait a little bit. I mean, first of all, this virus went crazy in Great Britain and then came down sharply. So we're just kind of at this sharp up right now. So taking a deep breath, change what you can, it might look really different and might possibly look a lot better in about a month. And shortly thereafter, the 5 to 11-year-olds will get vaccinated, hopefully by the end of the year. We didn't talk about that yet, but I know people.
That's my next question.
Yeah. there's so many things that can get better, but this was just a tough time for us to do this, just because of, where I'm sitting as a provider and a doctor, and knowing all of my doctors who take care of adult patients, what they're going through right now, and nurses and hospitals. It's just a tough time right now. This particular moment is a little raw and difficult. So all day long, I'm, hearing questions. Should I go to Hawaii? Should I do this? And I'm like, oh my God, do you know what's happening? It's been a little rough. And this particular moment poised is just a little rough, but generally, I think it is going to get better. I do think your vaccines are coming for your kids. The FDA just recently, just in July, when Pfizer was just poised to kind of finish up and wrap up in September and apply for FDA approval or for emergency use for children, the FDA wanted them to get more numbers to really make sure that the risk of myocarditis is as low as we think it is. And you needed more numbers to prove that, since that's a condition that can happen with a vaccine. So I think Pfizer is still planning on applying by the end of September. With the surge, they were able to get a lot more numbers. So for good or for bad of that, I mean, mostly bad for a surge, but they are getting the vaccine numbers that they need to get the data. I think Moderna maybe by the end of the fall is what I've heard. Johnson & Johnson is starting to study in kids as well. Younger kids under 5, it's going to be a little bit longer. We had thought they were going to be able to apply for 2 to 11, but it looks like Pfizer is going to apply 5 to 11 to have a more likelihood of getting it passed.
So any idea on that 2 to 4, 2 to 5 crowd?
I think I would say maybe by early next year, maybe earlier. The data is not that different. They're just looking at safer doses. When kids' immune systems function quite differently than adults, and they're looking at lower doses. If they were just going to do the same dose as adults, I think we'd have a lot more side effects, a lot more fevers and reactions to the vaccine. And with kids who really still overall don't get that sick from the coronavirus, the vaccine has to be that much safer. So, you can think about if the vaccine is going to cause, my hands don't work in here because it's not mirrored properly, sorry. But if the vaccine is going to cause fever for 3 days and pain and lethargy, and the disease is going to cause fever for 1 day and no pain and a little cold, it's hard to argue that the vaccine is worthwhile. And even though it's going to be spreading, preventing spread. So we just have to make sure we get a vaccine dose that's going to reduce the side effects and the safety.
So along that line, someone just posted in the chat that they read that the FDA also asked Pfizer for 6 months of follow-up data instead of 2, which pretty much makes it impossible for kids for 2021. Do you know if that's accurate?
I haven't seen that. I mean, they did ask for longer term follow-up, but they've been studying this in kids for a long time. So I think the bigger concern is just that they asked for more data. I think they're still in the time frame because they've been studying these doses in kids all year. They didn't just start.
And I'm going to let Emily ask a question, so it's not just me talking.
Hello. Hi, Dr. Meyer. Hi again.
Emily.
We just saw Dr. Meyer this afternoon at our 1-year appointment. It was very exciting. I have a question about resiliency in kids, and I don't know if you want to answer this or Dinah, or maybe a combination of the two.
Unfortunately, Dinah did have to sign off. She was joining us from the East Coast, and it's very late there.
I got it.
Dr. Meyer, it's just you. It's all on you.
I got it. I love this topic.
Something that I have noticed in this conversation, and pretty much every conversation I've had like this in the past 1.5 years, is we're very focused around asking how we can protect ourselves, how we can protect our family, how we can protect our children, and what do we do when our kids are having a hard time, and all of this. And there are 2 things that come to my mind when I hear these kinds of conversations. One is that we're being very reactionary. Even with the sort of coping skills that we're talking about, like what do we do when we're upset, or what do we do when we're stressed out, or what do we do when we're feeling trauma, right? Which are all important coping skills, of course. But the other piece that comes to my mind is sort of like our sort of tendency throughout this process has been to distance. Obviously, we're being asked to social distance, to become very insular. And I think that that's the right thing to do physically, but I think it's sort of, I felt like it's become something that we're doing very emotionally as well. And I'm curious about your thoughts, if you have any suggestions or thoughts about ways that we can approach the situation, especially now that we're sort of in a dip of devastation and depression, hopefully a short one, to get ahead and be a little bit more proactive about how to approach the situation, maybe not necessarily medically, physically, but more like mentally, emotionally, from a place of resilience. I can give you just one example that I like along the lines of what I'm thinking about, because I don't know if I'm expressing myself really well. Something that we have started doing with my older son, like my 4-year-old, because the 1-year-old, she just does 1-year-old things, is, when we have a school shutdown or just in general, something that we've started to do over the weekends is like, see who we can call to FaceTime, see who we can call to see if they need anything, see if we can drop by someone's house and, just be like, hey, we're going to drop by, say hi outside at the porch. Like, who needs our help? Who needs to be connected to? And we sort of frame it for him that way. Like, there are lots of people out there who might be lonely, or they might be feeling sad, or they might be feeling stressed. Like, what can we do to help them? And not only what can I do to make sure that I'm really safe and we're protecting ourselves from everyone else, because I know that that's something that's been a real struggle for me and my family this past year, of feeling like everyone just settled in their little pods and we were left all alone with a newborn baby for a year. And, there was a game of musical chairs last year, right when my baby was born. And we were left without a chair because we weren't ready to be in a pod, because we didn't know what to do with a newborn. And then so that sort of came out of this. But I'm curious just in general about your thoughts on what we can do to address these things from a place of positivity and resilience.
Yeah, I mean, I think you've kind of answered that, of course, like the things you do for community. I mean, I think it's really, I mean, you were in the hardest position. I mean, having a baby during this time. And I just talked to a mom who's about to have her second baby, and her older one is, 16 months old, like they're pretty close in age, but she's going to have another baby in a few months. So I think reaching out is great. I mean, I think we talk a lot with families about, your self-care is important though, because you're reflecting that for your kids. So staying, not saying all your fears and things in front of your kids, and we are going to react with some fear. So I'm really taking care of the way you present these things to your kids. Having kids go out, and I've had some examples. I hear people doing wonderful things every day, all day. Another similar to what you guys did, but a family who just sent little notes, like they just worked on and made little like happy notes to cheer people on and pass them out to all their neighbors. There's been kids who've brought signs into the hospital, and the nurses can just take these stacks of these little pictures with like happy smiley kid drawings and we love you and thank you for caring for us and all these things, and just like putting them all over people's hospital doors and rooms. I mean, people in the hospital are alone and scared. So like little things that your kids can do to contribute without scaring them. You don't necessarily have to tell them people are alone and scared. You can just frame it as, let's cheer someone up, or let's see who we can tell is smiling with their mask. And like, that's a fun game kids can play, because you can tell if people are smiling with their mask. People, smile with their eyes. So, finding little games to help kids connect to people. And yes, that, I think it's gotten a little better. People are more used to masks and seeing people and not crossing the street, and being a little bit more friendly. If you know of anybody though, who's having a baby, like Emily, like you've kind of were that, but now how that was, so reaching out to other people, making food trains and things that you can do, and meeting at the park, and connecting to people. If you know of anybody who's in that situation to be more socially isolated, reach out to them.
And Emily, I'll say that we did for Good Deeds Day, and it's always a Good Deeds Month that we did this year, and it's always open. Our community chaplain is always collecting cards to distribute at the senior living facility, Cedar Sinai Park, and other ones, so that you can always send any cards to our office, care of our community chaplain, and he does make sure they get to folks who are needing them right now. Some of the people on this call have been the benefit of my family's baking. We do a lot of baking and passing it and leaving it at people's doors. So I recommend that as well. It's also tasty. Dan, you have your hand raised.
Hi there, Doctor. I have a few questions.
Sure.
One, I haven't seen any stats, and it's something I just keep wondering. Obviously, there's more cases, so there's more kids getting it, right? I understand those stats, but I guess for me, I'm also curious if there's been any tracking of how many of the children that are getting it are coming from homes where the adults are unvaccinated. Is it?
Yeah,
It's more common, but
I think it is more common. I haven't seen direct stats on that, but I just kind of more anecdotally, many of the kids are, not all of them. And like I said, I mean, a lot of them have vaccinated families. So we don't know. So I do want to, speaking to that though, I think I've heard a lot of people say like, it's so unfair that our kids aren't vaccinated. And this is true, it's unfair, but I mean that we're throwing our kids out there unvaccinated and they can't wear them. If you have kids under 2, they can't wear a mask and they're not vaccinated. So it's pretty scary to have kids under 2 for a lot of people, but the vaccinated parents are huge. And it's what we call the cocoon effect. So there's the effect that we use really commonly for whooping cough is a good example. You can't give babies can die of whooping cough, but we vaccinate the pregnant mother, the parents, the grandparents. We create a cocoon to protect that baby from whooping cough. And I really think we're doing that even in our daycares, like by vaccinating the parents, by vaccinating the teachers, and by wearing masks, we're creating a safe place for our kids. And I think that they are very protected by our vaccines, even though they can't get their vaccines. But I haven't seen those numbers, Dan, but I just know anecdotally from what people have been saying that, that their frustration because not the parents who are not vaccinated, you want them to visit their kids in the hospital, but they're not vaccinated. It's just like a whole disaster.
Sure. Okay, I have 2 more quick ones. I was on another call where someone had sort of made a comment that Delta seems like it's kind of like, I think their words were like hot and fast. And you think about like it started in India, and India was having 300,000 cases, and India still has 30, 40, 50,000 sometimes, but it started there and they have over 1 billion people. So why are they seeing 200,000 or 300,000? So I was wondering if you've seen any information on that Delta does seem to kind of like, it's super infectious and it's just spreading to anyone who can get to, but because of that, it's in there, and then it's kind of.
Yeah, I did mention, that's true. I think that is what we're seeing. That's what they saw. That's what I was saying earlier, that they saw in England when they had a big surge, it came on and came down, and it behaves that way individually at some level as well, but definitely on a population level. That's why I was saying like, just give it a month, because this is going to be really horrible, brace ourselves, but it's likely to look better. I don't, but at what cost? That's the hard part, at the cost. So
yeah. Okay. And then my last question is, and it's funny because you were talking about how, vaccines in kids, you don't want to give them too much because you don't want to have such a reaction where they have fever for 3 days instead of catching COVID and getting a fever for 1 day. But that made me wonder, like I have my youngest brother, they have 2 kids that just turned 2 and 6, and they have not put their kids in school because the 2-year-old is particularly, it's growing and all the brain development. And so they're not so concerned about like a cough or a fever for a day or 2. They're worried about long-term effects like on the brain and development. So
yeah, I didn't mean to say that, like, you do not want your kid to get COVID.
Mhm.
I was kind of just more saying like when you're trying to sell a vaccine to a fan, it's just, some vaccines like smallpox vaccine used to cause super high fevers and big swelting scars that most of us who are over 50 have on the back of our shoulder, like smallpox vaccine was a brutal vaccine, but everybody stood in line to get it because it was a brutal disease. And so everybody this is a brutal disease, but by and large, most kids do not get long-term COVID. Most kids do not end up in the hospital. Most kids don't die. Most kids hardly know they ever had it. That is still true.
Okay, thank you so much.
So I'm going to have, we have a couple, Christy and then Stephen, and then I'm going to kind of wrap things up and then we can stay on if Dr. Meyer is able to, but I want to make sure to say some things before folks leave. So Christy.
Hi, so this might fall in the category of things you mentioned we don't have good evidence for, but I was just curious about, there's been a lot, seems like lots of news about booster shots for vaccines. And I was just curious, I was thinking about how there's been talk about 8 months and waning protection for vaccines around 8 months. And I know they haven't said anything official about people other than people who are immunocompromised, but it just got my head spinning about all the educators being vaccinated in February, and then 8 months feels like October, and it feels so positive with the vaccine mandates for teachers, but then anyway, it feels stressful for people.
Yeah.
Elementary
No,
kids. What do you think about that?
I think there will, booster is a tough question because it becomes very political as well. Not really, more like, when there's countries that are not vaccinated at all, it's become kind of a difficult thing for us, for the CDC to say, World Health Organization is kind of anti-booster because the world needs vaccines and we just happen to have a lot extra. I mean, we throw away vaccines every single day at my office. It's horrible, and I would like to take them, and pass them around and give them all to everybody. So, but I think the boosters are coming, and I think mostly because we know that they can cause a nice increase in our antibody levels and it might keep us from spreading it. We possibly don't need them to keep us out of the hospital and to keep us from being super, super sick, but it might really help decrease spread. And I think it would be, I think they might even move it to 6 months. I think the 8 months was to buy time personally, but I shouldn't say this is being recorded, but I think the timing of it is tricky. They've already, I think it'll be authorized for healthcare workers and immunocompromised. It already is. Healthcare workers and teachers will be next, and then the general public, but more of like a rollout of how we got the vaccine as well. So the timing should work so that people, if you got your vaccine when it was your turn, then you generally will get it approved for boosters in your turn.
Okay, that makes sense. It just felt like, gosh, then suddenly everyone's returning to school right when all the teachers need their booster.
Yeah, that's been thought about.
Okay, thanks.
Stephen.
Hi, Dr. Meyer.
Where are you? Oh, hi, Stephen.
You had mentioned a bit ago about an increase in babies being hospitalized, and we have a 5-month-old, so I was wondering if you could just elaborate a little more. Like, what are you seeing? Like, how serious are those cases? And in terms of like percentages, for baby exposure, it's increased now. Is that an increase of a small amount to another small amount that's still a really low number, or is it something that we should be?
Yeah, still low numbers for kids, and fewer babies, I guess, more children, and the highest, and pediatric hospitalizations are still by and large actually in unvaccinated 12 to 17-year-olds. That's the largest group. And then if you break it down by, and then again, I told you like the horrible race disparity in there that exists. But there have been some just isolated cases. It's still small numbers. There were hardly any children's hospitalizations before the Delta variant. And I think it's just that, and we still haven't seen hard data to really tell us the Delta is worse. But I imagine it'll be in the same way that it's worse for adults. And then, but there are, the other thing is that our hospitals being full too, like it has a lot to do with other illnesses as well, because a lot of children and adults have had a lot of delayed care and delayed services. So there's a lot of people who are coming in much sicker with things that have been put off. And so there's a lot of people in the hospital who don't have COVID as well. So, but the children have been mostly when they're in the hospital, it's either because they're young and they can't, they got dehydrated or they need oxygen. It hasn't, you've heard about the inflammatory condition in kids. That's been another one. And there's been a few kids hospitalized with myocarditis as well from COVID, not from the vaccine per se.
So finish. Sorry.
Yeah, I was just going to say, but no, I think your question, it's not a lot of numbers, and they are starting to report them on the Oregon Health Authority, so you can kind of track that.
I did see that today.
Yeah, the curve kind of goes.
So I want to honor the fact that it is a little bit after 9. We will stay on to answer questions, but I just want to thank everyone for sharing this evening and for asking your questions. The session was being recorded. We will be sharing the recording out. So if you have others who would benefit from this information, we encourage you to share it out. I'll be sending out a brief survey to folks just to get a pulse on how the evening was tonight, and it'll help us shape what you'd like to see in the future. Also, as Dinah mentioned, stay tuned for the information on the parent support group. It'll be in next week's PJ Library e-newsletter coming out on Wednesday. That will be beginning September 9th. So in September, we'll be meeting September 9th and September 23rd on Zoom. It'll be facilitated by Dinah in partnership with Jewish Family and Child Service. And again, I want to thank Rabbi Posen, Dinah Gilbert, and Dr. Erica Meyer for sharing with us this evening. So we'll stay on, but thank you again so much for being here. And I'll put it on gallery view so we can all see each other. And feel free to just, Callie, do you want to ask a question?
Yeah, thanks. I was wondering if you knew anything about whether or not a vaccinated breastfeeding mother can pass along any immunity to the baby through the breast milk. Someone was saying that they had read something about that, and I wanted to kind of double check.
Yeah, there are antibodies in breast milk. So yeah.
Awesome. So this is going to be a little more casual. Feel free to jump in with any questions as you have them.
Does anybody have some breast milk I can give my 2-year-old? Yeah, did you see that coming? Did you see that coming?
I do. Lord knows, Dan, that if I could go back to lactating, I wouldn't a second to protect my children. Matan weaned a month before COVID. You better believe I wish that we had been able to, he was 3.5, but it was time.
So unfortunately, when you share breast milk, it is recommended that you boil, pasteurize the breast milk, which then denatures the vast majority of the antibodies. So just in case.
Charlotte. We can't hear you.
Oh,
now we can hear you.
We can.
Okay. So my question is regarding a preschool. I have a 3.5-year-old who will be attending a preschool program twice a week for 2.5 hours. I received a packet of information saying that masks will be required for ages 5 and up. My 3.5-year-old has been wearing a mask since he's been 2 and he can do it. But I'm just like kind of perplexed at like that policy and kind of figuring out like, I really want him to go. He really needs to be social right now, but like, I don't know how to feel about that.
Yeah, I mean, the 2 to 5-year-old age group is tough. We all know, it sounds like 2, 3, 4-year-olds are perfectly capable of wearing masks if it's expected of them and it's seen as normal and it's not, seen as something really pitifully awful for them. It's really hard for them to wear a mask if everybody thinks it's horrible. But there is a balance of, speech and education and teachers' abilities to connect with the kids and to read their emotions. These are important things to balance out. So I think it's just a tough question. I think different schools and preschools and daycares are I don't think there's one strong right answer. I do think there will be less spread of COVID if all the kids 2 and up wear a mask, and the American Academy of Pediatrics has said it's quite safe and there, there's no issues with oxygenation. That's, that's really just made up. That doesn't exist. But there are maybe some issues for some teachers and the ability to connect. And, I'm curious how this will pan out for the schools where they do, because kids can learn to read faces quite well. And I mean, eye contact is, you talk about kids on the autism spectrum who have, trouble with eye contact. Those kids are going to be forced to use eye contact. So there might be some positive developmental outcomes for kids where the teachers and they are wearing masks, because they'll be kind of learning to read people by looking into their eyes, which is an important skill. So, yeah, I don't want to, throw any schools under the bus. I don't know which and which. I know some schools are certainly requiring that. And I think they're just kind of taking that as the safest way to do from the COVID perspective. But there is a cost to that.
So in the chat, somebody asked, I'd like to know if my child's teacher is vaccinated, but when I asked, she said she couldn't share. Do you have a recommendation on how to handle that?
We need Dinah for that.
I think just what I'm reading, it's also going to depend if it's a K-12 public school program, it's going to be mandated as of mid-October.
I guess it's not, it should, I don't know how to answer that. I mean, everybody should be vaccinated if you're going to hear kids, but people have personal, I don't know how to, I wish I could help with that. But I think you're right to ask, and you have the right to ask.
Can I ask that? So I think I don't know if it's a follow-up. I mean, I know that both of the schools, well, now they're only going to be in one school, but all the teachers in that school the school has publicized 100% vaccination status of all staff, which, like, yay, surprising. Okay. But that doesn't mean that all the parents are in that. So, like, we can talk all we want about, like, in the classroom, what they're going to do as protocols, but the temperature checks or the check-ins that schools are requiring. And from my space, I remember something you said, like, I don't know, I think you said this 6 months, 8 months. I don't remember how long it is. Time in COVID, it doesn't matter. You said, like, kids' immune systems are strong, and that's why they're not, like, their immune systems know how to throw everything at everything, and they don't get sick. Like, they do, but they recover from a cold in like 3 days, where if I get that cold, it's like a week, because my immune system isn't as strong. And you gave this example basically of like how their immune systems were so strong at that. And then my kids went to a camp where they didn't have the same, as a day camp, one of them didn't have the same protocols. And within the first cold, both of my kids ended up with croup. And it was we've never had croup in our house, right? So it was this sort of like, whoa, I felt so safe in COVID because you told me that my kids' immune systems are strong, and like they were. Croup was one day. So croup was one day, which I know that it wouldn't have been if they didn't have strong immune systems. So I'm holding that. But I'm also in this Delta variant space, and I'm thinking about adults who are maybe not taking, or families who are not taking the same protocols. And I wonder, this may be a Dinah question, I know she's not here, but like in your space, right, as a professional, as you're weighing risk, the school risk versus the social risk versus the, like, where are you, if you had a kid, if your kids were young again, like what were I just, maybe you can say, like, I'm not going to answer it, but what risks would you be willing to take in this space right now?
Well, first, just because you quoted me, but I wasn't, when I say kids' immune systems are really strong, I just mean they get these high fevers and they are capable of throwing a bomb at a virus. They get high fevers, whereas a sophisticated immune system like we have, actually, I wasn't saying we're sicker, theirs are better, theirs are different. Your system is like a sniper going after a specific disease. Your system has experience. Our adult immune systems know what they're doing. They have lots of memory cells. And
do you think that that's still true since kids haven't had colds in like a year and a half?
So we could talk about that too, but kids' immune systems, it is still true that kids' immune systems are not very specific. They're developing that, but they still, and kids can get sicker longer because they don't have that specific immunity. So kids can have a cough for like 2 weeks. They're not good at clearing their airway. They're terrible at it. So I wouldn't take too much generalizing from the specific of one, your cases, because like somebody has asthma, they're going to be sicker, and there's lots of different factors there. But kids just do fight things in a very different way. Their immune systems are different, not better, and arguably worse at some ages. But would I take, but that being said, we all know, numbers being numbers, they have not fared poorly, other than socially and emotionally and academically. They have not fared poorly medically from the Delta virus or from any of the COVID virus. They just haven't. It hasn't been like it's been with other diseases. Like I said, this disease, COVID-19, doesn't pick on kids. They get it, they can get sick. Yes, they can get long haul COVID, but it's still relatively rare. It's not a disease of children. And they might be a big part of spread, and they're going to be, we want them to get vaccinated, but it's not like RSV in that way. Would I send my kids to school? I still think the school, I don't know what's going to happen with Delta. Maybe if I had the luxury, I might wait a little bit and see what happens. But I think that the schools are very safe places for kids to be with the cautions that they're putting in place. I'm really impressed with how few outbreaks there have been in schools. Because I mean, the big outbreak in Israel that they had at a school was when it was really hot, and they had all the kids they broke the mask mandate. They had the kids, because it was super, super hot, so they let the kids go crowded into the air conditioning with no masks, and then they had a huge outbreak. But that was one of the school outbreaks. So no masks, going indoors in a poorly ventilated space. Yeah. But your schools are doing a great job. I mean, all the schools in the area are requiring teachers to be vaccinated. All the schools are ventilating their spaces and have upgraded their filtration and air filtration. They're all requiring masks for kids 5 and up. Many of your preschools are requiring masks for 2 and up. So I think there's a lot of layers of safety out there to protect our kids. And, who knows what I would do. And I don't even know. I let my kids go to college. I mean, that was crazy enough.
I want to check, are there any other questions tonight before we end? Okay, well, I want to thank again, Dinah and Dr. Meyer and Rabbi Posen and all of the families who shared their questions tonight. This isn't easy, and I hope we don't have to repeat the session, but we will repeat the session if needed, and know that we will continue to be a resource, and we're happy to work with you and help you get the resources that you need. If you are affected by COVID, there are resources in the community, including the CNS COVID response team that we can put you in touch with. So thank you again so much, everyone, for being here tonight. And we hope to see you all safely soon.
Good night, everybody.